Hi, I'm Catherine Jean Lopez from the National Review Institute, where I direct the Center for Religion, Culture, and Civil Society. I'm really grateful for you joining us today. At NRI, we've been doing a series of post-Roe virtual events. You can find out more information on our website at nrinstitute.org. And I want to thank our co-hosts today, the Christ Medicus Foundation, Her Plan, and My Catholic Doctor. We're talking today about pro-life healthcare after Roe. And joining me are Louis Brown, who's an attorney and the executive director of the Christ Medicus Foundation, a Catholic healthcare nonprofit that supports the medical costs and whole person health needs of its members. Kathleen Burchelman, that wasn't that hard, who is a doctor, an MD, Dr. Burchelman, who's a pediatrician, wife, mother of 7, and co-founder of Catholic Doctor, My Catholic Doctor. And Cheney Mullins works at Her Plan. And now that I've been humbled in butchering your name, Dr. Burchelman, I want to thank you and bring you all into the conversation. And maybe since I did do that, we'll start with you. Can you tell us what My Catholic Doctor is, what it does, why it's important?
Thank you so much, Catherine. I'm Dr. Kathleen Burchelman, and I'm the co-founder and CEO of My Catholic Doctor. And we are a nationwide network of pro-life clinicians, and we offer telehealth and a national referral network. So about 90+% of what we do is telehealth, although we do now have 6 in-person locations. And then we have a large referral network. So if you need in-person care and there's we don't have an in-person location near you, we make a referral. And our commitment is to make Catholic healthcare accessible to everyone. And of course, Catholic healthcare is pro-life and pro-eternal life from conception until now.
I think we broke up a little bit there. Louis, do you want to jump in? Because I know you're on My Catholic Doctor's board.
Sure. I think, thanks for doing this, Catherine. So grateful, and grateful for National Review Institute. Kathleen, Dr. Burchelman, is a gift, and what she is doing through her leadership at My Catholic Doctor is really extraordinary. It is a national Catholic healthcare entity that's serving Americans across the country in life-affirming care, providing high-quality care via telehealth, which we saw was such an important and valuable resource to providing medical care to people, particularly during the pandemic, and even now and going forward into the future. The fact that we can place medical professionals, doctors, and other healthcare workers in instant touch with patients across the country to provide life-affirming, highest quality care. That's what Dr. Burchelman's doing through My Catholic Doctor. I'm grateful to serve on their board, and they are doing valuable work, even more valuable now that we need life-affirming care, more of it. We need to applaud existing pro-life medical professionals and medical centers across the country, like My Catholic Doctor, but we need more of it. And my hope is that My Catholic Doctor can expand robustly to do even more of the work that it's doing right now across the country.
And I'm sure we'll have Kathleen back soon. One of the things that amazes me about My Catholic Doctor is my understanding is doctors found wanting to have an organization where they could be with like-minded doctors.
Right. That's right. Now it looks like Kathleen's back, and it's just kind of exploded, and I'm hoping it will continue to explode. So I'll let Kathleen answer that.
Kathleen, we just did a commercial for you.
Well, thank you so much. I apologize for my technical challenges. It's been my joy and privilege to watch this organization grow leaps and bounds, and I did nothing to make that happen. It's been my joy to interview more than 300 pro-life clinicians that want to put their name and face on a website called My Catholic Doctor. In this culture, right? I mean, when we first started this organization, one of my colleagues at Washington University, St. Louis, my former employer, said to me, Kathleen, this is professional suicide. But despite that, I've had more than 300 clinicians come to me and say, I want to join. And it's been my joy to hear their stories, and they're profound stories, many of them of significant persecution that they can't go public with because they'll lose their employability. But it's my privilege to share with you this incredibly good news that there is no shortage of pro-life healthcare providers. In fact, I believe the Lord calls them to it, and it's really written on their heart. Now, what there is a shortage of is employment opportunities where they're allowed to practice with that full pro-life voice and the full scope of pro-life practice, where they're allowed to talk about abortion pill reversal and set up these programs, where they're allowed to talk about being pro-life from birth until death, where they're allowed to talk about pro-life in healing and in mental health, right? And we can do that all at My Catholic Doctor. And it's my joy and privilege to create a platform where all of these people can practice that way.
Before we go back to Lewis and bring Cheney into the conversation, can you just talk about, especially for maybe doctors or people who want to be potential donors or people who just want to understand, how does this actually work in terms of seeing patients and insurance and all of that?
So we accept all major insurance plans and Medicaid in 6 states and Medicare in 50 states. We are now medically staffed in all 50 states, praise God, plus Canada, Mexico, and the UK. We also have a self-pay plan if you're a health share, if you use a health sharing ministry or you're uninsured. We have very affordable self-pay rates, and anybody can access this. You don't have to be a member. You don't have to sign up. You just, click that button that says, see now or make an appointment. And then you pick your clinician. It's not just the next available. Like a lot of telehealth, you just see who's ever available. You're really going to make your own choice because this is a very personal experience, right? And so you really want to pick your clinician.
Thank you. Lewis, thank you for stepping in, talking about My Catholic Doctor. Talk to us about Christ Medicus now.
Sure. The Christ Medicus Foundation, and thanks again, Catherine, and thanks, Kathleen. The Christ Medicus Foundation is a Catholic, Christ-centered healthcare nonprofit dedicated to sharing the love of Jesus Christ in healthcare and to defend our medical conscience and religious freedom rights for all Americans to care for the body, mind, and soul of our brothers and sisters across the country. We do that, Catherine, in 3 ways. First, we defend conscience and religious freedom in healthcare and life-affirming care, particularly for the vulnerable. We advise and help to grow and expand pro-life medical centers and medical entities like My Catholic Doctor. And we also provide a Catholic health community of Catholics across the country that are coming together in community to share their medical costs and to advance and grow in physical, emotional, and spiritual health, which is so vital in our culture right now. And so this is an important moment. In some ways, the life of the Christ Medicus Foundation has been prepared for this moment since our foundation, which is created to ensure and to help to be an instrument of God so that all of our brothers and sisters know of the love of God, particularly in their medical needs. If you look at Catholic healthcare, Catherine, the beauty of Catholic healthcare is that it's not just doctrine. The beauty is that God designed the body. And so the more that we help medical professionals, and the more that we help patients to be in touch with their whole person in their healthcare, not only are people more spiritually sound, but also it results in better healthcare outcomes. So we're defending medical conscience and religious freedom, particularly for pro-life healthcare professionals and medical centers that are on the tip of the spear of this next wave of healthcare in this post-Dobbs environment, thank God. And we are building Catholic healthcare communities so that, God willing, we have millions of Catholics coming together in community as the body of Christ to care for the spiritual, physical, and emotional needs of our brothers and sisters. That's our mission, and we were built for this exact time, Catherine.
Why is the healthcare sharing part of it so important?
Because it's just one of a few things that we're doing, but I think Catholic health sharing, Christian health sharing is very important because it reflects true Christianity, that people of faith come together in community to care for each other, to love each other, Government has a proper role in advancing human flourishing, but human flourishing is done best when people come together, centered in God, centered in love, to care for each other. And we need more of that, not less of that. And as human beings, as Catholics and people of goodwill come together to care for each other, that expands human flourishing. It expands love. I'll give you an example of that. There's a famous study, Catherine, of that Harvard University did of the determinants of longevity, of people living longer. And what that study determined, what clearly showed, and you see this over and over again, that one of the top determinants of longevity, of long life for people, which in part includes better health, is meaningful relationships. Another way of saying it is one of the top determinants of health, Catherine, is community. And so the more we can bring Christians, people of goodwill, into community and how they experience their healthcare in communion with God, it results in better health outcomes. It results in human flourishing, and it advances the common good in civil society. That's why we think Catholic health sharing is important. We're doing that not only through health sharing, but in helping our members that are part of our community, Catherine, grow in their physical health, grow in their spiritual health, grow in their emotional health. We did a conference about that a couple of weeks ago, and we're really excited about the work we're doing there. Needed now more than ever, I think, in our country, at least in my lifetime.
It's really all of this is beautifully, creatively countercultural and quite necessary. Cheney, thank you for your patience in being part of this conversation. Tell me about what her plan is doing.
Thank you so much for having me, Catherine. I'm Cheney Mullins Gooley. I'm the provider support manager for her plan, which stands for Her Pregnancy and Life Assistance Network. And what we do is build directories of care. Lewis mentioned that we have physical needs, we have emotional needs, we have mental needs, we have spiritual needs. What we want to do with her plan is bring together providers that can meet all those diverse needs of pregnant and parenting women and families. So our scope goes from the conception of a child until that child turns 2. That's the first 1,000 days of life. And it's the needs of both that child and the pregnant or postpartum mother. And so it's very important to us to have diverse providers. So when we say provider, we definitely mean medical provider, but we also have social providers and material providers. And we organize those needs by 7 categories of care. And those 7 categories are based on the reasons why women think that they need an abortion. And the concept is that we can provide alternatives now in a post-Roe America that meet her tangible needs that might have driven her to desperation before. We can meet those needs holistically by bringing pro-life providers together. So anyone that does not support or refer for abortion, we list in our directories. And currently on directory.herplan.org, you can see our directories for Georgia and Virginia. West Virginia and Mississippi are coming next. And then by the end of next year, we plan to have a directory in 30 states of holistic care for pregnant and parenting women and families.
The obvious question when you talk about the first 1,000 days, and I just saw somebody put it in the chat, is what after? What about after that? So often abortion advocates say that pro-lifers don't care about the baby after it's born or the mother after she gives birth. Can you speak a little bit
Absolutely.
to that?
Great question. So the beauty of this network is that together we are introducing providers to other types of providers they never would have known. So we end up with food banks and lawyers and foster care, wraparound services and adoption and childcare and medical providers. We're going to list every provider on My Catholic Doctor. So when you end up meeting the providers, you realize that they are serving the pregnant and parenting population, but they also serve additional or older children as well. And so often it's quite seamless to have ongoing care.
And Catherine,
so
if I could. Oh.
No, go ahead, Lewis.
Yeah, and I want to add on to that. I think that's a very important question. It's vital to show, and Cheney just illustrated this. We have faith-based hospitals, we have pro-life medical centers, we have crisis pregnancy centers, thousands of them across the country that are serving millions of pregnant women and children and families today as we speak. It's remarkable. The work that Cheney does illustrates that. The work that My Catholic Doctor does illustrates that. We need more of it. We need to expand that. That's vital to show. Part of the expansion is the importance of Catholic and pro-life primary care. You have places, and I'm going to tell the story of Bella, a natural women's care. Bella Health and Wellness is a phenomenal pro-life primary care medical center and more in Colorado. And they establish an amazing relationship with their patients such that mothers will come in there not just for baby number 1, but baby number 2 and baby number 3, and provide care to the mom, to the husband, and to the children, not just for 3 months, not just for 6 months or 9 months, but for a lifetime. So we part of what we are working on, I think all 3 of us on this call, is to expand the availability of primary care that's pro-life across the country. So it's not just for that one time only situation with the mother and the baby, but it's for a lifetime. And I think it's a big part of the solution set going forward.
Kathleen, it does take some courage for these doctors to come forward. As you said, I forget if it was before we started or after. People think it's professional suicide for you to be before the banner of My Catholic Doctor. That must be the case with a lot of the doctors that you work with.
I've seen so many now. I'm interviewing 300 of them, and their stories are so beautiful that actually, despite significant persecution in so many different realms, they're still here, still trying to do it. I just don't see that the Lord's not going to provide for us. I think the providers are there. What we need is economic models of support and large establishments so that we have economy of scale.
Because you need to be part of the medical community, but yet you have to build an infrastructure that's self-sustaining and to some extent, right?
We do. And so we have to find a model where we have a large enough group of Catholic healthcare providers that are able to negotiate with the insurance providers and also with our like-minded friends at organizations like the Christ Medicus Foundation that will provide us with the political and legal support we need to really make that economic model where primary care, pro-life primary care is financially sustainable. Right now, it's actually extremely difficult to practice full scope primary care from a pro-life perspective and accept Medicaid. And that's a tragedy that we need to be talking about.
Louis, can you talk to that a little bit? Because this is the religious freedom and conscience piece of it.
Yes, right. And so an important message for everyone watching this is we just had the Dobbs decision, which is perhaps the most important decision in American history. And it's definitely one of the most important decisions. And so much of the pro-life community is appropriately focused on abolishing abortion at the state level, which has to be the primary task. I would say the number 2 task for us as a pro-life movement is to eradicate abortion from the healthcare industry, particularly in states where abolishing abortion is not helpful or is not possible. Where in those states where the abolition of abortion is not going to happen, it's vital that we come together as a pro-life community to protect the conscience and religious freedom rights of crisis pregnancy clinics, of pro-life medical centers. That is a massive part of the battle going forward, is to ensure that we don't have state governments and governors violating federal law and discriminating against pregnancy clinics and pro-life medical centers. We have to talk about the fact that existing federal law, Catherine, protects pro-life medical centers, crisis pregnancy clinics from being discriminated against because they will not refer for or provide abortions. I think some of that discrimination is happening. Unfortunately, I think certain state governments appear to be discriminating against these pro-life medical centers and crisis pregnancy clinics in violation of federal law we have to hold them accountable. That's unacceptable. It violates federal law. It's unjust and it's immoral, and it should not stand.
And I'd like to jump in right there, if you don't mind, and talk about discrimination at the level of medical education. So organizations like the ACGME that accredits medical schools and residency programs, making rules that you can't complete a residency in obstetrics and gynecology, or midwifery training programs also, that you cannot graduate from these programs without learning abortion. It's tremendously unjust. We had a midwifery student from a Catholic school come to us because she was told she could not graduate without learning abortion. And the Catholic school told her, we'll lose our accreditation unless we teach abortion. And finally, there was a negotiation, and she agreed to learn it on a mannequin in simulation only. But this is where we are. I know medical students and applying to residency, and also college students applying to medical school, that are asked, oh, you went to a Catholic school. How will you handle this patient in a crisis pregnancy? And that's a legal question in an interview. You can't ask about somebody's race or marital status or how many children they have, right? But you can ask that question, and they're allowed to choose not to accept you into their medical school, into their residency program, because you have pro-life views. And this is one of the reasons why it's been so incredibly difficult for our pro-life clinicians to persevere through medical school and through residency. But it really is my joy to say that the Lord has provided. There's no shortage of pro-life healthcare providers. And they came to that at all different points, some of them after their training, some of them before. They all have their stories of how they persevered their training. But we have to change this. It is unjust that pro-life clinicians get discriminated against in the medical training system.
And does it give you hope that so many doctors opt not to do abortions, that there are more pro-life doctors than we know?
It does. And even the ones that the Lord is providing. I witnessed a abortion doctor at a nurse's station in a major city hospital with probably 20 plus staff, nurses and medical residents standing there at the nurse's station, just suddenly tell his story when he saw me there about why and how he stopped performing abortions. And he says in front of everyone, I kid you not, he said, I was so nervous to stop because I was afraid my partners would kick me out of our partnership, out of our practice, and I wouldn't be able to support my family. But one day I just told them I didn't want to do it anymore. And they said, okay. And I went to confession, and that was it.
Wow. That's such a reminder that we should always be thinking in terms of conversions. I think of Dr. Bernard Nathanson, who famously went from performing thousands of abortions to becoming a pro-life spokesperson, activist, and he too was Catholic and got himself to confession, converted to Catholicism and got himself to confession. Cheney, can you tell me, one of the best kept secrets are these medical care centers, pro-life medical centers, all the different resources that you're collecting in this directory. Are there some shining lights you'd want to share?
Absolutely. So I love that we're talking about conversions too. Her plan, actually, one of the original founders was Dr. John Bruchowski, who had his own conversion away from doing abortions and becoming a Catholic doctor. And he operates now Tepeyac OBGYN, which is the largest pro-life private practice. And what's really unique is that her plan was actually piloted in the Northern Virginia area under his desire to connect more. We had the medical piece at Tepeyac, but how do we connect more to the mental health piece, to the pregnancy centers that are often the first responders to a woman in crisis? How do we connect more to the infant loss providers, the prenatal diagnosis support, the care for children, the pediatricians? We needed a more holistic network. And so, speaking of those shining cities on a hill, I would definitely say Tepeyac is one of those. And it's been wonderfully encouraging to see models of pregnancy care centers in the Northern Virginia area actually giving a stipend, either a per patient stipend or a monthly donation, in order to help Dr. Burchowski be able to afford to see more patients in need. And I think that gets to what Dr. Berkelman was talking about with the fact that we need in the pro-life donor infrastructure, we need ways to support medical providers offering expanded medical services. So that can look like choosing them intentionally to be clients of those particular practices. It can look like donating if there are nonprofit medical practices. It can look like innovative ideas like paying off the insurance tail or paying the medical malpractice so that a pro-life doctor can actually leave their secular practice and go out on their own. We need some big donors and some big ideas to create an even stronger infrastructure. And Dr. Berkelman was mentioning the fact that there needs to be employment opportunities for medical providers who want to practice according to their conscience. And I think there's a real opportunity to merge the medical pro-life movement with the pregnancy help center movement.
That's vital, Cheney.
Pregnancy care centers are so active, and there's about 3,000 in this nation. Not all of them are medical, but actually 78% provide ultrasound services to women. And so in many ways, they're referred to as a pregnancy clinic, but there's opportunities to grow that, because even though 78% do ultrasounds, only 30% do STD testing, and really only 10% test for more than gonorrhea or chlamydia, and only 5% do prenatal care, 11% do abortion pill reversal, and 2% do well women exams. And these are stats from the 2019 Charlotte Lozier Institute study. And so we have an opportunity to add those sorts of medical services to a pregnancy clinic. So what they're doing now isn't incorrect. It's just incomplete for the needs of a post-Roe, post-Dobbs world. And we can think about innovations like a pre-abortion exam and H&H testing so that women come to us first, or after their abortion. We can think about a post-abortion exam so that we can have a medical follow-up with them when sometimes the abortion industry won't. And I was just at a conference with Abby Johnson, who was saying 50% of abortions are repeat abortions. How do we interfere after the first abortion so she doesn't go and have another one? Can there be a medical service that can intervene at that point? We can think about miscarriage medical care and progesterone supplementation to prevent miscarriages, and medical care if miscarriages do occur that are respectful to the dignity of every human life and respectful to the grief of the women. And many secular or mainstream healthcare practices don't have that same value of each and every human life. So I think there's a lot of opportunity here. There's great work from groups like Guiding Star and Obria and Stanton and Thrive to innovate in these ways, but there's also independent pregnancy clinics that are innovating in these ways. I think we're on a trajectory here to have a wonderful marriage of pregnancy help and life-affirming medical care to have a more holistic definition of what pro-life healthcare really is.
And as Lewis was talking about earlier, that primary care piece is so essential, because you can have a relationship before the pregnancy, after the pregnancy, obviously throughout the pregnancy. And Kathleen, you were going to chime in.
Well, I love the work of her plan, because everything Cheney said is so true. And we at My Catholic Doctor are ready and waiting to connect those dots. You know, I believe that we're probably the largest group of trained abortion pill providers nationwide. And what we can do is very rapidly initiate the progesterone therapy that's the mainstay of abortion pill reversal treatment. And we can order it. We can see the patient through telehealth and order that and get it sent to a pharmacy, make sure the patient takes her progesterone. But then we need to make that referral within 48 hours, but preferably 24, for an ultrasound, which is such a key part of abortion pill reversal services. And that's where the network of these crisis pregnancy centers becomes so important. So where the crisis pregnancy centers have the ultrasounds, and I can't do an ultrasound via telehealth, what we have is the abortion pill reversal services. And we're like so close to actually connecting these dots. I can't wait to see it happen.
Kathleen, Cheney was talking about donors, and I get the impression that some people might think that you're a boutique kind of healthcare option for maybe people with a little more money and a little more elite status in the world. That's the furthest thing from the truth, right?
For sure. We see all people. And it's actually our joy to serve all people, regardless of religious affiliation, regardless of financial standing. And we certainly do. There's tremendous diversity of every kind in our patient population. But what we are not is a group of rich doctors providing concierge level care and making a lot of money. In fact, My Catholic Doctor has never broken even. We've gotten very, very close, but we do still depend on donations to run. And there's huge opportunities. For example, I have a board certified OB-GYN that would love to run our abortion pill reversal service. And she's licensed in more than 30 states. And she can do this. She can provide the emergency abortion pill reversal service and get them to a crisis pregnancy center for ultrasound. But right now, I have no way to fund it. If I got an angel donor and she's willing to work below market rate, if I could salary this woman for $100,000, we would have that service up and running within 3 months. And the same thing with our multi-state licensure. It costs about $14,000 to 30-state license a pro-life clinician. But when we do that, what we're doing is we're taking pro-life clinicians and putting them in states that are, very, very abortion friendly, right? So we're putting we're able to license physicians in states where it's really, really hard to practice as a pro-life clinician. In those abortion-friendly states that really discriminate against pro-life physicians, we license physicians and bring them into that state via telehealth. But that multi-state licensure costs about $14,000. I have 2 physicians right now looking for angel donors to pay for that. And they, many of them have left. I mean, I have one doctor that has been very open with his story, leaving the University of Vermont, having been the last pro-life voice on the University of Vermont Ethics Committee. And ultimately, and as a father of 5 children, didn't have that $14,000 when he left the University of Vermont, and then angel donor paid for his multi-state licensure. He's now supporting those 5 children and practicing in 30 states. So praise God. And there's so many wonderful opportunities like this to make true pro-life Catholic healthcare accessible and with almost immediate results that you can see and feel and hear the stories.
That's beautiful. For people who don't know what abortion pill reversal is, could you just explain that briefly? And what is the market, for lack of a better word, for this?
It's growing tremendously. This old model where there's a pregnancy resource center which has a nice lady in a box, and then they may have a doctor that's reading those ultrasounds, and it's usually a retired OB-GYN that volunteers for free to read a very small number of ultrasounds per month. That model needs to change because we're seeing so many more people in crisis pregnancies. They're coming in earlier, and what amazes me is their presentation after they've taken the first abortion pill, right? So most abortion is now pharmaceutical, and abortion pills are 2 pills. You take that first pill, and then there's this incredible conscience. I mean, this is the natural law written on these women's hearts. It blows my mind that the women who have these pro-choice women in terrible personal situations who have already, gone through all the steps to get abortion pills that are usually a telehealth appointment and the pills are mailed to them. And they take the first pill, and then there's such amazing conscience, guilt, that they call us, an organization called My Catholic Doctor, and are seeking abortion pill reversal services. And we're able to give them medications that stop the abortion, and they're able to retain that pregnancy much of the time. And it's more effective the earlier you initiate it. If it's after the second pill, it's harder, but it's really just some medications they have to take immediately. And then we have to then get them right into a pro-life OB-GYN. Now, actually prescribing them, seeing that patient in her crisis over telehealth and prescribing the medication to stop the abortion, the pharmaceutical abortion, actually is not very hard. It can take a long time because the women have a lot of personal and social needs, but just prescribing a medication and having her fill out the pharmacy is pretty easy. But what takes a huge amount of time is then connecting her to a pro-life OB-GYN who will see her in person. And most of the time, of course, these patients are of limited financial means. And so we're asking for charity care. So for our staff, it can be easily 6-8 hours out of a day, mostly arranging for further care for that woman and her baby. And all of that is expected to be a volunteer. I always say, I don't know any volunteer abortion doctors, but everybody wants the doctors doing abortion pill reversal to be volunteers. I receive requests, about 3 or 4 a month looking for a doctor to do volunteer crisis pregnancy work. And my doctors are so busy now, and they stop, they have large families and the practices. And when they get these abortion pill reversal cases, they cancel everything and take care of this woman and her baby. But after a few times, they start to say to me, can someone else take this next case? Because it's so much work and so much time. And I'd love to get to a point where we can just salary a board certified OB-GYN with multi-state licensure to provide this essential service that is just growing and exponentially in the need.
Wow, that's amazing about the conscience, the testimony to that that you're seeing. I want to say, I haven't said this yet, but some people have figured it out. You can put some questions to us in the chat box and I'll weave them into the conversation. And there's actually one that, Louis, you might want to take. Are there pre-med and or medical student organizations to help promote these pregnancy health centers, like volunteering in them, bringing awareness to these services to other medical students so that we can tell our patients about it? And she adds that, I'm asking this because my school has medical students for choice who are circulating a petition to include abortion learning objectives and options counseling with the accreditation requirements of each medical school.
Yeah, that's a great question. So a couple thoughts on that. First, thanks for your courage. I can't tell you how often I've met with pro-life nursing students, medical students, mental health students that are getting their graduate degrees in mental health that are experiencing some level of persecution, isolation because of their pro-life beliefs. And so that's a massive issue. A couple different resources for students. I think the first 2 resources that come to mind is starting or joining the Catholic Medical Association or the Christian Medical and Dental Association for those that are people of faith, particularly of the Christian faith. Those are outstanding national organizations that are supporting existing medical professionals and students that are also studying into the healthcare profession. I also think of the Alliance for Hippocratic Medicine that the American Association of Pro-Life OBGYNs APLOG started. That's going to be an increasingly important resource, not only for medical professionals, but also for students studying in the healthcare fields. I also want to point out that we have the benefit in our nation of good federal laws that protect conscience and religious freedom, not only of medical professionals and healthcare workers, but also of medical students. That's in particular, it's called the Church Snow Amendment. And so if you're a nursing student, if you're a medical student, and you believe that your conscience or your religious freedom rights are being violated, particularly on the issue of abortion and the education that you're experiencing, I encourage you to file a complaint at the U.S. Department of Health and Human Services, because if you're experiencing that discrimination due to your pro-life beliefs, that's a violation of existing federal law. So Christian Medical and Dental Association, the Catholic Medical Association, the Alliance for Hippocratic Medicine, also the American Association of Pro-Life OBGYNs, which exists not only for existing practitioners, but also for students that are studying in the healthcare professions. Very important to be connected. Very important for you as a student not to go it alone, but to have a community that's going to support you in your appropriate, just, and ethical pro-life beliefs.
And if I could add one more to what Louis just said, I just got back from the Christian Community Health Fellowship Conference. If you don't know about CCHF, please look them up. They are basically inspiring medical students and residents and then full-time practitioners and clinicians to engage in at-risk needy communities in America. So primary care in America from a Christian life-affirming integrated perspective. So they care about social determinants of health. They have clinics that accept multiple insurances and have Medicaid and have a sliding fee scale and have a community garden where they can write prescriptions for healthy food, and they have a physical therapist. And there is so much innovation going on right now in the CCHF community. So definitely look at them as well.
Kathleen, Can you talk a little bit about how people are finding you, and obviously you confidentiality, but what patients are saying, why they're seeking this out?
We are blessed to have a 5-star average on our Google reviews, not 4.9. We average 5 stars. Praise God. So our patients are very happy with our services. Right now, unfortunately, our marketing is very limited. We'd love an angel donor to help us with a marketing budget, but that's truly our limitation is financial, and why we're not marketing right now. And people are just hearing about us from word of mouth.
Kathleen, also Cheney was talking about like an integrative approach to healthcare. One of the scandals of women's healthcare is that girls get put on contraception very early on because they figure, well, they'll need it anyway because they'll be having sex, but also to hide symptoms, right? To not actually get at the root of problems that they're having.
For sure. So I love adolescent medicine from a Catholic perspective, and I'm a pediatrician, so this is really one of my passions, right? That young women struggling with menstrual issues, they really need an evaluation. Is this polycystic ovarian syndrome? Which, so many people treat that by just starting oral contraceptive pills, when really there's very excellent treatments that can allow that young woman to preserve her future fertility, to prevent later diabetes. Really important medical interventions that are ill served by simply starting an oral contraceptive, which just masks symptoms, right? So there's all kinds of therapies that can be used to appropriately treat all of the challenges of adolescent gynecology. And some people call this functional medicine. The Catholic doctors have been practicing this for all the antiquity, but it's really modernized now. With advanced diagnostics, we're able to really quickly diagnose what is the root of the problem. Is this a vitamin or mineral deficiency? Is this endometriosis? Is this polycystic ovarian syndrome? Is this a hormone imbalance? Is this prediabetes? Any young woman struggling with these menstrual issues needs a full evaluation, not just oral contraceptives.
Louis, can you talk a little bit about the biggest challenges you see right now? And I want to get from the three of you really, I've been trying to ask this of all of our speakers as we have these post-Roe conversations. What are your marching orders for people? What need to be our priorities when we think about pro-life healthcare? And I mean that as a policy, as driving our policies, but also as you make choices for yourself and your family,
right?
And realize what our priorities need to be at this point in time when it comes to pro-life healthcare.
I think of three things, Catherine. The first is, thank God for St. John Paul II, who told us to be not afraid and told us to be courageous in proclaiming the culture of life. Abortion is not a right. Abortion is murder. Abortion is not healthcare. And so it's important that we go out as people of goodwill, as people of faith, to build up a civilization of love and justice, particularly in healthcare, and to do it unapologetically, and to do it in a manner in which we are courageous, heroic, and unafraid. Abortion has taken the lives of over 60 million unborn children. A disproportionate number of them have been African American. It has been devastating for the Black community. It has been devastating for women of any color. It's been devastating for America. We need to engage the cultural debate. We absolutely need to do that. A civilization of love and justice built on the culture of life, which is important to all other, it's vital to all other human and civil rights. So that's the first thing. We need to continue to engage the cultural debate and lovingly persuade, lovingly challenge the zeitgeist and the narrative with love, with truth, with justice, and to be instruments of healing. That's vital. You can't persuade or evangelize someone if in your heart you hold extreme contempt and resentment. That's number one. Number two, it's absolutely essential that as we move to abolish abortion at the state level, that we massively expand the availability of pro-life medical care. As we as a pro-life movement, we must be thinking about what is the law as regard to abortion in my state, and what is the law in terms of supporting the availability of pro-life care. The third thing is to take a pro-life worldview in our personal and professional decisions in healthcare. If you're a business owner, how can you take a pro-life worldview as you make a decision for your company? If you're the leader of a university, how can you make a truly pro-life mission-centered decision for healthcare at your university? For yourself and your family, how can you support and take your family to be in the care of a pro-life medical center of pro-life physicians? We need to divest as employers, as consumers, as individuals, as family. We must divest out of pro-abortion healthcare and invest with all that we have into pro-life models of care. That means hospitals, that means medical centers, that means telehealth, like My Catholic Doctor, that means supporting pregnancy clinics. Maybe the Holy Spirit is calling you to start up a pro-life medical center in your local community, in your state. Maybe the Holy Spirit is calling you to transform your pregnancy clinic into a full resourced pro-life medical center that offers primary care that can serve people for a lifetime. Those are challenges. Those are changes that we need to make. That's what I believe God is calling us to be courageous in engaging the cultural debate, to protect conscience and religious freedom, and to expand pro-life medical care.
Cheney, I see you nodding your head. This really is a time for people to dream big, isn't it? Whether you are the person with the financial means, or you're the expert, you're the doctor, there's a role for everybody in this.
Absolutely. I think that we have been thinking too small, and look at what we have now. Look at the victory. Look at overturning Roe versus Wade, which many of us thought would not happen in our lifetime. What else are we missing out on because we're afraid to dream big and pray big and trust more in the possibilities and in the accompaniment that God will do with us and that we can do for one another? Just as we accompany women in need when they're pregnant or parenting, we can accompany one another into taking these steps outside the pro-abortion healthcare system. And we can be specific with donors about our needs. Dr. Berkelman was saying, we really need to be able to pay doctors to provide abortion pill reversal. If you're a pregnancy clinic, ask your donors for money to do that. We can educate donors about why it's important that the care doesn't stop when the woman chooses life. The care needs to go on. That's the beginning, not the end. We need the abortion pill reversal or the prenatal care or the delivery fees. This is a time to show that we care for women holistically and completely. And we are stepping up, we are expanding. We have at Her Plan an entire church program where we give churches models of how to engage more closely with the assistance providers on our directories. And one of the models we recommend is morning centers, and they do prenatal care inside church buildings. They are doing that much innovation. This is the time for these kinds of ideas. And if we can't expand the pregnancy clinic, what can we do to refer and have a deep relationship between the pregnancy center and the pro-life doctor in town? What could that look like? At Her Plan, we've developed a HIPAA secure referral portal. So for free, any life-affirming provider that's part of our network can log on and have a HIPAA secure platform that can send a direct referral about a patient to their next care provider if she needs to go to the counselor or the adoption agency or the pro-life OBGYN or the homeless shelter or the food bank. You can make those connections securely within our platform. So we're excited about what that's going to do for continuity of care.
Kathleen, I think you love this question. Is it possible to share a wish list for angels like you mentioned? I think that would be a great list to put together.
I'm very happy to. We're looking for $100,000 to fund a pro-life OB-GYN to run our abortion pill reversal service. I already have a woman meeting that criteria that would be happy to have the position. We are looking for $14,000 times 2 to multi-state license our pro-life clinicians, and there is a much longer list that goes down to even just sponsoring one woman dealing with abortion pill reversal and paying for her services.
And I might follow up with you so we can send that out to the people who at least registered to watch this live.
I'd be happy to provide that. Thank you.
Kathleen, do you want to have some last words about how people should be thinking about pro-life healthcare, both in their personal decisions and as a culture, as policymakers, wherever people are?
I'm a very practical person, and I like to start with where each individual can really affect change. The first thing I'm going to ask you to do is pray to storm heaven. If you're a person of faith, storm heaven, and that to make pro-life healthcare accessible. The second thing I'm going to ask you to do is to think very clearly about where your healthcare dollars are going. For most families, for most employers, for most orders, for most organizations, one of their largest expenses, if not the largest expense, is healthcare, right? And I always say that people pay for health insurance, not healthcare. So think about where your healthcare dollars are going. Are you making pro-life choices? If you're not, can you change that? Can you at least even call your insurance companies and say, do you have a directory of pro-life providers? You know, I was on a call with a diocese and with a major health insurance company. I'm not going to say which one it was. This health insurance company lists every clinician has to say whether or not they provide specific LGBTQ services, and the diocese to ask the insurance company would they also list whether they provide Catholic services consistent with Catholic teaching, and they declined. They said no. So even if you just told your insurance company, we want your directory to list whether or not people provide culturally sensitive care from a pro-life perspective, you know, that would be such a huge win. So where can you affect change? I think just really speaking up to where your healthcare dollars are going.
And I just want to give everyone a chance to say some last words. Louis, do you want to go first here?
Sure, I'd love to. You know, I'm so grateful for Catherine and your courage and reminding us about being joyful, Catherine, and want to thank Cheney and Kathleen for everything you all are doing, have done over the years. We have to move out. We have to prayerfully move out to share God's love for all people in healthcare. It's vital that we do that now. It's not a time to be silent. It's not a time to be afraid. We have to be courageously outspoken and active in caring for God's people in our nation right now in their healthcare. The second thing is to reiterate what I said earlier. The second thing that is vital is to see the intersection, to see how intertwined our medical conscience and religious freedom in healthcare is to protecting and advancing the availability of pro-life medical care, particularly in states that are predominantly pro-abortion. This is a massive issue. We need to ensure that we are holding our elected officials accountable to protect and to defend conscience and religious freedom in healthcare consistent with federal law. And please, please, please do whatever you can to build up pro-life healthcare, particularly for consumers. That's the work we're doing at the Christ Medicus Foundation. We are seeing extraordinary success. We need your help. We all of these organizations need your help. We need you to join us in the effort to continue to advance the culture of life, more important now than any time in our life. Thank you, Catherine.
We certainly need courageous people in states like my own New York, where the governor has signed into law things that, as you said, can't possibly be legal, and harassing pregnancy centers and the like. And so thank you for the work that you're doing. Cheney, you were so patient in the beginning. Let me give you the last word.
So sweet. I've really enjoyed this conversation. I think it's so important because so many pro-life activists have been faithful for years with prayer and sidewalk ministry and resources, and now they're getting more educated about medical topics and healthcare topics, and vice versa as well. For a long time, medical providers have not thought about how the pro-life movement affects them and how they need to be making intentional decisions about where they practice. And so we're seeing this merger now of pro-life and healthcare, and it's a beautiful thing to see. And at Her Plan, we are building that to its full potential with our directory. So I encourage you to sign up if you are a provider of any medical, social, or material services. Please go on herplan.org and sign up to be a part of our directory. It's completely free, and it's important that we grow state by state to have a stronger safety net for women and families. And if you're a church or a pro-lifer, even if you don't lead a group at your church, you can go and take our free online church assessment to challenge you to get involved in the service side of the movement, including healthcare, also on herplan.org. Thank you so much.
And I should point out the elephant in the room here, Susan B. Anthony, Pro-Life America, which used to be the Susan B. Anthony list. Her plan is a project of Susan B. Anthony Pro-Life America, which I'm going to get used to saying. And I point that out because the Susan B. Anthony list was established to elect pro-life people to office. That has been a successful venture, it's safe to say. But this isn't primarily about politics, the abortion debate, the pro-life cause. And so I think it's really important that you're doing that, and I'm grateful for that. Even just the witness of it, I think says so much. And I also should mention, we in the chat box have seen a comment about a girl who is abortion minded. And it's just a reminder to us that as this is in the headlines, as people are arguing about it, abortion is about real people and real struggles. And that's why Kathleen's doing what she's doing. Cheney, you're doing what you're doing. Lewis, you're doing what you're doing in all these different realms. And so thank you, Kathleen Burchelman from My Catholic Doctor, Lewis Brown from Christ Medicus Foundation, and Cheney Gooley from Her Plan. And again, I'm Catherine Lopez from the National Review Institute. We'll have another post-Dobbs conversation, Life After Roe conversation on Friday at noon with two doctors, Dr. Stephen Christie and Gracie Christie. And so please join us for that. Take a look at nationalreviewinstitute.org. Look at all the links from our organizations, and I think you'll get a follow-up email with that as well. And thank you so much for your time. And please feel free to share this on YouTube if you're watching it live, the National Review Institute's YouTube page, or if you're watching it after. It's really important that people know what is going on beyond just Roe ending, and what it takes to really build a culture of life. As Lewis, you were talking about, pro-life healthcare is essential. So thank you again so much.
Thank you, Catherine.
Thanks, Catherine. God bless you all.